Swelling of inner eyelids after Botox and persistent headache. What do I do? I had Botox yesterday. The injections were more painful than usual. Not the needle, but the pain of the liquid being injected into the muscle. It was enough to make me feel sweaty and nauseous. Today I woke up and I didn't recognize myself. The inner corner of both eyelids is completely swollen and bulging, and it makes me look like a completely different person. My eyes are too wide apart. It's worse on my right side, and I still have a headache on my right side. I don't want to leave the house.
Thank you for your question. You submitted your question with two photos, and you describe in your question that one day prior you underwent a Botox injection and that you recall that there was pain as the Botox was being injected into the muscle, and that this following day you have swelling in the inner corners of your eyes and you have pain on one side. And so naturally you're looking to figure out what's going on. Well, I can certainly share with you my perspective based on this information in the absence, of course, of a physical examination. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I've been using Botox for patients since 1993. In fact, our specialty of oculofacial plastic surgery were amongst the first physicians to use Botox long before the rapid expansion and growth of the indications for cosmetic. So to begin with, let's start with understanding a little bit of the anatomy, because I think it's always important to at least understand the anatomy, because that will ultimately lead to some degree of understanding of possible explanations. So when Botox in the way it was done for you is being injected, the needle is going through the skin and entering the muscle. And the point is that the Botox is being delivered to the muscle to relax the muscle. And there is certainly a couple of possibilities just by that alone. Muscle itself is fairly vascular. It can get maybe some degree of irritated or inflamed, so that can account for some of the fluid, as well as that there are multiple sensory nerves, and these are the nerves that give you sensation to the skin, that travel in that same region. So it's also a possibility that upon entering the skin and going into the muscle, the needle could have also irritated some of these nerves, and that can also be responsible for this essentially spasm that results in headache. Now, interestingly, of course, you're probably aware that Botox actually helps treat headaches, and a lot of people who have a history of tension or migraine headaches will benefit from the use of Botox. I think for now what you're dealing with is a little bit of fluid that naturally is a response to either the amount of volume that was injected into the forehead, depending on how your doctor does the dilution for the Botox. It can also be from, as I mentioned earlier, irritation of the muscle as well as irritation of the nerve. So generally speaking, in a situation like yours, conservative management is typically indicated. That means doing things like taking anti-inflammatories like non-steroidals, and even doing something like cold compresses in the first 48 hours to try to mitigate some of the potential swelling. There is so much nuance in the art of placement of Botox that is always individualized. There are techniques that we employ that minimize penetration of the muscle. There's different dilution strategies, and there are different ways that can be done so that this type of situation could potentially be avoided in the future. And I think that's worth discussing with your physician and seeing, and I'm assuming that there is some follow-up plan for you. In our practice, when we do Botox injection or any injectable, we see our patients in 2 weeks after the procedure for me to see what the outcome is, also to see if any enhancement is indicated, and further to learn about what the dosing and response of the patient is, so that this strategy can always be tailored to future treatments. So I think that for now, I think there is no reason to feel that there's anything much more serious going on, other than the consequence of some localized reaction. I would advise that you keep in contact with your doctor. Mention this to your doctor as soon as you can, so that at least your doctor is aware. Your doctor may want to see you in person and maybe give you something more than just a non-steroidal to help expedite the management of this fluid. But in the meantime, certainly it is important to at least learn about this anatomic relationship where muscle, nerves, and needles can sometimes interface and result in inflammation and swelling, but certainly is not usually anything to be concerned about long term. So I hope that was helpful. I wish you the best of luck, and thank you for your question.